So I'm here to talk about why my baby had to have a procedure done at 6 weeks old. Oh, go ahead, baby, still shine. To give a little backstory, to just go straight into it, and y'all can already see pretty much by the title what he had to have done. When I was in the hospital, they do your skin to skin. They try to latch the baby on, and the nurses were like, oh, you have very flat nipples. You're going to need a nipple shield when you get over, to the postpartum side. Ask the lactation consultant. I've always known my nipples were pretty flat, just because they don't really get hard or stay hard or like protrude out like others do. And so, for that reason, that didn't surprise me. So they couldn't get him to latch or whatever. So then, once I got to the postpartum side, they were just telling me to, still keep trying. And once I was able to keep trying, he actually did latch on. It hurt so bad, but I thought it was supposed to. So for myself, I'm just like, whatever. And basically, to make a long story short, I continued. And by the time I got out of the hospital, I was there for 2 days. By the time I got out, my nipples were bleeding, cracked, sore, everything you could think of. And so I'm just like, whoa. The lactation consultant had told me, it's not supposed, oh, you want to be seen, baby, okay. It's not supposed to hurt. And so I'm just like, okay, well, it's hurting me. And she was like, that means he doesn't have a latch, he has a shallow latch. So, just keep trying. They wouldn't give me a nipple shield, yada, yada, yada. So I came home on a Thursday. By Saturday, I could not latch him anymore. When I tell you, as soon as he would suck on, I would scream to the top of my lungs and start crying. And I'm not talking about tears. I'm talking about crying because it hurt so bad. And they're like, okay, yeah, definitely, But I didn't want to give him a bottle because I didn't want to confuse him. I also didn't have an electric pump at the time. I only had my Hakas, but I had to do what I had to do to feed my baby or whatever. So I had to get him a bottle. And I'm like, okay, what is going on? Because he was giving me what's called lipstick nipple. It's when it flattens your nipple or flattens a part of it. He was only latching onto the very top. And so, for that reason, I had to take him to the pediatric dentist because he had a lip and a tongue tie. When I took him to his pediatrician didn't think anything. And so I brought it up before we left. I'm like, okay, my baby don't be latching. I've been feeding him out of a bottle. Can you look in his mouth? She looked, and I was like, I think he has a lip and a tongue tie. She said he had a lip tie, but it seemed okay, but, I can go get it assessed. And she was like, his tongue doesn't seem to cause any problems, so I wouldn't recommend getting that assessed. I'm like, whatever. So when I went to the pediatric dentist, yeah, tell them. You remember that? I know you do. You're not really talking to mommy, but I know you remember. But when I went to the pediatric dentist, they labeled his lip tie and his tongue tie a class 4 lip and tongue tie. And there are 4 classes. A class 4 is the worst. So I said that to say, if you are having pain or anything like that, please go to your pediatric dentist. Don't just listen to the pediatrician because, the mouth ain't really they playing for you, so they don't be knowing that much. But because of that, I got them both revised or released through a laser procedure. It was very quick, probably about 5 minutes. If you don't have dental insurance, you'll have to pay out of pocket, and it hit the fuck out of your pocket. So I'm just saying, it was $800 for me because I don't have dental insurance for this boy because he don't have no teeth. But yeah, so after that, you do have to do some exercises in his mouth for physical therapy, which I'll insert here.
Okay. And I'm using my index fingers to sweep into the cheeks, lift the lip up to cover the nostrils, and then I let it go. Next, I'm going to take my index finger and swipe underneath the lip, back and forth 4 times, and then we're done. 1, 2, 3, 4, and that's it. Okay.
it is recommended that you actually see a lactation consultant afterwards, because as their mouth is healing, even if they had been on a boob. So Kai actually hadn't been on a boob. I had been bottle feeding him, but even if they had been on a boob, they basically have a brand new mouth. So for that reason, you know, you have to retrain. Well, they have to relearn how to use that mouth and learn how to latch on and all of that. So it is recommended that you see a lactation consultant. So I met with my lactation consultant, and she also showed me some body work exercises that I should do for him, which I insert here.
When think about when our back is tight and stuff and we want to stretch, or if we're tight like in our neck or whatever, one side is usually tighter than the other. So what I'm gonna do is take his little legs and bring this thigh. I'm gonna push this shoulder down and bring this thigh that way. So we're kind of just gently
Oh, I love this stretch.
They're just little people, you know, so like if you like it, he probably don't like it. Let's see. He's letting us do it so far. Okay. So then we switch to the other side. I don't know if you can tell, but one side is way looser than the other. And so it's real gentle. I'm not real pushing him too hard. You can do that a couple of times. You can bring his knees up and then kind of roll him almost like his feet are coming to his face. Same thing with his legs the other way, right? So we can just kind of straighten them, push on his little kneecaps, straighten them out. So we want to take his head and just gently kind of take it both ways. So whichever way he turns, so he's going this way. So we're going to turn it that way and then just kind of gently hold it for a minute. Okay. And we're going to try to get him to go the other way. Gonna go that way. This side's a little tighter, you see. So I'm not forcing it because I'm not gonna hurt him, but just kind of trying to encourage him to go that way. He's like, what is happening? There you go.
Hey, boy. Yeah.
There you go. So these are just some gentle stretches, and that's it, really. You can take his little shoulders, stand at his feet so he doesn't kick down, and just pull him down. Kind of like when your neck gets tight, you know, and you want to just. That's kind of what we're doing. They usually like it. You don't seem to mind. And then we can, you can do a little belly kind of massage, especially if he hasn't pooped in a minute, you know. He don't seem to have that problem, but you know, kind of roll it up. There it is.
All of those things are, you know, just to help with the healing process. The physical therapy is to make sure that it doesn't reattach itself, because if it does, it'll reattach itself like tighter. And the body work is to loosen up the tension in his body, because although it is in his mouth, they do affect other areas of his body. So he is pretty tense. So we're working on that. But I just wanted to share my experience. Now he is 2 months and he does latch on. We're still working on it not being painful. Sometimes it's not the best, sometimes it is. If you have any questions, any experiences, definitely leave a comment. Ask me. I'm here. Peace. Say bye, Kai. Yeah. And we out.